with other patients and caregivers and come together as a community. And hopefully leaving today, you will leave with a greater understanding of what the latest is in breast cancer management. But maybe you'll also meet fellow folks who are going through similar things. And I hope that it's an enriching and positive experience for you. I also hope you take away from this how committed all of us are as a medical community, as a research community, as an advocacy community, to focus on metastatic breast cancer and really continue to try to find better solutions through these events, through research, through coming together. So as I mentioned, this idea for this conference was initiated by Sandy Cassanelli, who with her husband, Craig Cassanelli, and her family, started the Breast Friends Fund. And you'll hear a little bit more about the fund from Craig Cassanelli, but they have really, through years of dedicated effort to fund breast cancer research, they have absolutely done a remarkable job. So with that, I will introduce Craig Cassanelli of the Breast Friend Fund, and Craig will tell you a little bit more. Thank you so much.
Thank you, Maryam. Good morning, everyone. My name is Craig Cassanelli, and I represent Breast Friends Fund. My wife, Sandy, who was a metastatic breast cancer patient at Yale Cancer Center, started Breast Friends Fund about 8 years ago. She recognized the importance of funding metastatic breast cancer research because she found that many charities only devote a small percentage of their total proceeds to research, usually only 7 to 12%. At Breast Friends Fund, we cover the administrative costs and work as volunteers so that 100% of the proceeds go directly to Dr. Weiner and his group for research. This is important because metastatic breast cancer often receives less funding than it desperately needs, plus there have been many funding cuts lately. Breast Friends Fund participated in the Closer to Free ride in September and raised over $32,000. We are planning about 45 different events in our community in October and November. To date, thanks to Sandy's hard work, Breast Friends Fund has raised over $1.7 million in total proceeds for research. Sandy helped start this event, Caring for Metastatic Breast Cancer, because she understood firsthand how overwhelming this disease could be for both patients and caregivers. She believed firsthand that the more knowledge that families could gain, the better equipped they would be to face the challenges ahead, make informed decisions, and partner effectively with their oncology teams. Sandy often said, knowledge is power. And for her, that wasn't just a phrase, it was a guiding principle. She knew that information empowers patients to ask the right questions, explore the best treatment options, and take an active role in their care. Just as important, she believed knowledge gives caregivers the strength and confidence to support their loved ones through this journey. This event reflects her vision, a place where patients and caregivers can come together to learn, share, and find hope. By continuing what Sandy started, we honor her belief that education, compassion, and community are essential parts of the fight against metastatic breast cancer. I remember our first day at Yale Cancer Center, and we walked in very nervous and very anxious, not knowing what to expect. What we found was a team of doctors, nurses, and staff who not only cared for us medically, but also cared for us as people. They took the time to explain everything clearly, answer our questions with patience, and treated us with compassion and respect. That kindness made all the difference in the world during our difficult time. In closing, I want to sincerely thank everyone at Yale Cancer Center for the care and support you gave my family during our journey. I wish you a very successful conference today.
Thank you so much, Craig, and it really means so much that you're here today with your daughter Samantha, and very much appreciate all the support. I will next introduce Eric Weiner, Cancer Center Director at Yale, and just incredibly known, internationally known breast cancer physician who we have the pleasure of working with. So Eric, the floor is all yours.
I think this says keynote presentation. I'm going to change it to keynote comments. Thanks for having me, and thank you all for being here with us today. Before I make some comments about metastatic breast cancer in general and cancer research, I just have to talk about Sandy for a sec, because I was Sandy's doctor for a long, long time. I actually first met Sandy when I was at Dana-Farber, now probably 10, 11 years ago. I first met you, correct?
Yep, well, 10.
Yeah. And had the real honor of taking care of Sandy throughout her entire illness. And when I moved from Dana-Farber to Yale, it sort of worked out really well for Sandy, because Sandy was getting a little annoyed by certain things that were going on in Boston. It's a great place, believe me, totally great place. But Sandy was getting a little frustrated and was ready to do something different. And she lived in Connecticut. And, I walked in and I said, sorry, I'm going to be leaving Dana-Farber. I'm going to Yale. And, she was ecstatic because she could make that transition. And I think Sandy is someone who, in truth, I never would have met in my life if I weren't her doctor. We came from different places in the world. We had different interests. We were very different people. And it just goes to show that you can get so close to someone and you can care so much for someone who you think might be just very different from who you are. And it was nothing short of a joy taking care of Sandy all these many years, getting to know Craig and Samantha and Amanda. The one other thing I just want to say is that in the year 1995, when I was early in my career, Sandy, with the illness that she had, probably would have lived a year or two. And Sandy lived with metastatic breast cancer for a decade. Now, a decade isn't 5 decades, and that's where we want to go, and I'm going to talk more about that. But it still represents real progress. And she lived with that illness and lived really quite elegantly with that illness for a long, long time. So we all miss Sandy. Metastatic breast cancer is very different from what it was when I first became a medical oncologist focusing on breast cancer. And it's really all that I have done in my career is focus on breast cancer. Back in the 90s, we had a handful of drugs. There was no such thing, and you'll hear more about this later, as targeted therapy. Somebody would say, what kind of breast cancer do I have? And my answer would be to tell them what stage of cancer they had. But that's telling them how much cancer there is. Or in the case of metastatic breast cancer, it's always the same answer. It's stage 4 breast cancer. But it doesn't say anything about the personality of the cancer. And through a tremendous amount of research, we have learned over the years, and this has been an evolving process, that breast cancer and metastatic breast cancer isn't one disease. It's many, many different diseases. And the cancers have different personalities and different behaviors. And of course, that's also affected by the person that the cancer arises in. It's not just about the cancer, it's also about what we often call the host or the person in which it exists. And when we think about cancer treatment, we have to think about both the person and the cancer. because if we don't, we're going to miss the boat. You're going to hear later this morning, depending on which breakout session you go to, and then more when you hear about clinical trials, about the different subtypes of metastatic breast cancer. And in fact, those subtypes are proliferating. You know, we used to talk about HER2 positive breast cancer as a distinct entity. We're learning that HER2 positive breast cancer probably isn't one single entity. It matters whether it's also estrogen receptor positive or estrogen receptor negative. And our ability to what I would call fine-tune the treatment is getting better and better. None of that happens without science, and science is critical. And science isn't just about the science that touches patients in terms of clinical trials. Science starts in the laboratory, whether that's a laboratory where they're pipetting and doing experiments, what we often call a wet lab, or whether it's a dry lab where people are taking huge amounts of data, and with now the assistance of artificial intelligence and other such approaches, trying to understand patterns in that data, trying to understand how we can really make progress that much more quickly. So science is critical. Science, this basic science, then needs to lead to clinical trials, which lead to new treatments. So between 2010 and 2020, there were 30 new drugs approved for breast cancer. Now, I can tell you that probably between 1970 and 2010, there were probably about 15. And you can see that the acceleration in terms of our understanding of both cancer, and by the way, this isn't just about breast cancer, it's other cancers as well, because we've made so much progress across the board. And of those 30 new drugs, 26 of them were for patients with metastatic breast cancer. Some of them subsequently have been used in patients with earlier stage breast cancer as well, but their initial approval was based on clinical trials in patients with metastatic breast cancer. Some of those trials demonstrated that patients' cancer was under control for longer. Some of them demonstrated that quality of life was better. And increasingly, more and more of them are showing that we actually, with these new drugs, make people live longer. There was actually a time in my career when people would say that there was no evidence that all the treatment we gave to women with metastatic breast cancer made them live a day longer. And the truth is, at that time, they weren't far from being right. I don't think anyone would have done a study comparing no treatment versus treatment, but the implication in terms of our drugs on longevity was really quite minimal. Today, much more frequently, when new drugs are approved and we see new drugs, they're having a significant impact on not just how well we control the cancer, which is important, but perhaps more importantly, and more importantly to all of you and to all of us, is how long somebody lives. And that's really critical. We still have progress to make. And I think that all of you, certainly all of you sitting in this audience who have metastatic breast cancer and your family members, know that all too well. And to be clear, one of the reasons I think that some of you may feel like October is a little overwhelming and there are a little few too many pink ribbons out there and everybody's like waving a sign with a pink ribbon, is because there are a lot of people who have breast cancer where it's still traumatic, but where there's no potential that that cancer is ever going to threaten their life. Breast cancer is really a disease that is, as I mentioned, very, very mixed. And there are people who have breast cancer that ultimately can be life-threatening. There are a lot of people who have breast cancer where it's really simply not life-threatening. But again, all of you know that this is a disease that is, or an illness, I don't really like the word disease, but an illness that is potentially very, very serious. So where are we in 2025? There are still over 40,000 women in the United States whose lives are lost from breast cancer, and that's largely metastatic breast cancer. It's basically exclusively metastatic breast cancer. And if you expand that to a worldwide view, and increasingly, I think we have to look at the whole world, there are 670,000 women worldwide who lose their lives from breast cancer. And to put that in perspective, that's 10 times the number of people who have died in Gaza over the past 2 years, which is a horrific tragedy. And so that's a tragedy that we recognize. And this is 10 times that number. And so from my standpoint, the lives lost from metastatic breast cancer are a huge tragedy. And that's why we're all doing something to help prevent that. I also would be remiss if I didn't say that, of course, suffering and loss of life from breast cancer isn't distributed equally in our country. If you are a Black woman, you have a 40% higher chance of dying from breast cancer than if you're a white woman. And those kinds of inequities we also have to address. And if ultimately we are going to prevent deaths from cancer in general and from breast cancer, we have to both figure out the science and we have to make sure we have drugs to deal with resistant cancers. And we also have to figure out how we deliver care to people and how we make it easier. And by the way, it's not just Black women or women who, for whatever reason, have other disadvantages who are at risk for not having that care delivered. It's all of us. And, you know, I will share that when I try to navigate the health system, and I'm the most, you know, connected human being on the face of the earth, and you would think can get whatever I need, it's hugely frustrating. So imagine what it's like for anybody else who doesn't know all of this. So we have to make things easier. So where are we going? I think that we're going pretty rapidly to a time when treatment is going to continue to get better and better. It's a stepwise process. Among patients who have HER2-positive metastatic breast cancer, the progress in the last 2 decades has been breathtaking. And our ability to help people live dramatically longer lives, even when the cancer has spread to other parts of the body, so even in patients with metastatic breast cancer, is incredible. Recently, our progress in the setting of triple-negative breast cancer, often thought to be the hardest subtype of cancer to treat, has been quite incredible with the development of both immunotherapy in that area and so-called, and you'll hear more about this later, drug antibody conjugates. And it feels as though we're on the brink of finding a number of additional approaches. And finally, for women who have the most common subtype of breast cancer, estrogen receptor positive and HER2 negative, where hormonal therapy is often the mainstay initially, and then we move on to other treatments. Both hormonal therapy is getting better rapidly, both because we have new anti-hormonal drugs and because we have drugs to pair with those drugs that make them work ever so much better. Drugs like, and some of you may be familiar with these names, with the so-called CDK4/6 inhibitors and other such things. So the progress has really, really been amazing. None of that changes the fact that that it's really hard for all of you. You know, it's one thing to hear we're changing, you know, metastatic breast cancer into a chronic disease. I will note that most people would prefer not to have any kind of illness rather than have a chronic illness, but it's still better to have a chronic illness than a life-threatening illness. But so you hear that this is a chronic problem, but you also know that unfortunately, it also can be a problem that ultimately threatens your life. And it's scary, and you know, it's something you all live with on a day-to-day basis. And everybody figures out their own way how to cope with that. But I think that what we would believe is that as doctors and nurses and social workers and pharmacists and everybody else on the healthcare team, that we can help all of you by providing information and providing the very best possible treatment, which we think about very intensely and are constantly talking to each other about the patients we take care of to make sure that there's nothing that any of us individually have missed, because 5 minds or 50 minds are better than 1. But the other thing we can do is we can care. And I think that it is really, really important when you're a patient with a serious illness to feel comfortable with the people who take care of you. When you're totally healthy, okay, you're a 22-year-old person who's working out every day and you've never had a health problem in your life, the part of your quality of life, if you think of quality of life as a big pie, that is about your relationship with your healthcare team, is like a tiny sliver. You can't even see it. Like, you might as well, you could just go to a walk-in clinic once a year when you have a cough, and it wouldn't matter. But when you're somebody who's dealing with the healthcare system all the time, how you feel about your relationships with that team are really, really important. And I will tell you that as a group, we really spend a lot of time thinking about that, focusing on it. And I hope we live up to the way we would like to be. I think with that, I'm going to end. I really, truly believe that there is a huge place for optimism here. And I think there's room for optimism for people, not just who will be diagnosed in the future, but for all of you sitting in this room with metastatic breast cancer. There are clinical trials going on that are going to yield results that will affect you in 6 months and a year and in 2 years. And there was a time when we would go to our national meetings, and if there was one new drug that had some small benefit, we'd cheer. And now there are essentially now 3 meetings a year with major findings at them. And at each and every one of those meetings, there are multiple new treatments being described. So be hopeful and reach out when you have questions. And with that, I would be happy to answer any questions that any of you may have. We probably have about 2 minutes, 3 minutes.